Medicare update with as much information as we're able to offer. My name is Lynn Stanton. I'm the director here, and I'm also a certified SHINE counselor, which is an acronym in the world of acronyms for serving the health insurance needs of everyone on Medicare. So that would be true even if you're under 65 and you're home with a disability. So welcome, I'm glad you came. This is an important time of year for folks who are retired, and I'm glad that everybody's paying attention, or at least, you know, the 25 people in this room. I don't know what to say about the rest. I want to give you a little basic information. First, an awareness about a scam that we just heard about. You will not, under any circumstances, receive ever a phone call from Social Security, the IRS, or Medicare. If anyone calls you and says, I'm from Medicare, I'm from the IRS, that it's a scam. They do not call you directly. You'll get information in the mail. They never, any of those three groups, never ever call you on the phone. So just hang up. You don't have to keep them on the phone to get more information, to refer it to the police, because it's really hard for them to track, you know, these sorts of phone calls. So just hang up. It's a scam. No one from Medicare, Social Security, or the IRS is ever going to call you. So just, you know, be safe in that respect. Some general information. We do not have, as of today, this morning, moments ago, we do not have dead sure information on the Medicare Part B premium for 2016. It looks like at the moment it's going to stay at $104.90. For those folks who are single with earnings, adjusted gross earnings from your 2014 income tax return, if you have income adjusted over $85,000 as a single person, your Medicare B premium will go up. You will pay a little more. But that has been true all along with regard to folks in that income category. And that's through that's over $170,000 as a married couple. Wouldn't that be great? So if you earn $170,000, your adjusted gross income on your 2014 tax return, your Part B premium will go up. Otherwise, for the majority of folks, it's still, so far as we know, going to be $104.90 for 2016. I haven't heard otherwise. Nobody in SHINE has heard otherwise. It's not on the Medicare.gov website for 2016 either. So just, you know, I want you to be aware of that. There are more SHINE programs with Medicare 2016 updates available throughout the Merrimack Valley right about now. And if anybody's interested in programs that will be held later in the month, just give me a shout and I'll give you those dates. There are some practically every day somewhere in the Merrimack Valley. So that is that. Now, for 2016, if anyone has health insurance through the GIC, which is the Government Insurance Commission, folks who are state or municipal employees, anybody who has retiree information from their former company. If you're on a supplemental plan through your company, if you have any questions about those plans, you need to call your Human Resource Department or your Personnel Department, because those are particular to those companies or to that group. That's not something SHINE folks specialize in, because the plans available through your former employers that you may have are special contracts that they make with insurance companies. For instance, if you have Blue Cross Blue Shield through Lucent Alcatel, I'm just saying that off the top of my head, what's available to you is quite different than what's available to the rest of the population. So do take some time, if you have a retiree plan from your former employer, to find out what's available, what changes have occurred, because that's not something we're privy to, if you will. The SHINE program basically is a free program. It offers you unbiased insurance information. We're not reps from Tufts, we're not reps from Blue Cross Blue Shield, so we try to give you the straight story and find ways to save you money. That's my primary reason actually for coming into the program. A, because it's so bloody confusing, and B, because it's so expensive. So if I can find a way to help you save, that's a positive thing. And again, it's partially funded through the state, so these, again, are your tax dollars at work. Most of the SHINE volunteers are, most of the SHINE counselors are volunteers. I'm here at the Council on Aging. It's just now part of what I do for my job. But again, those are your tax dollars at work too. My position is funded through the town's real estate taxes, so you pay for that as well. But you don't pay extra. It's just your tax dollars at work, if you will. Open enrollment, which is your opportunity to change your insurance plan or to sign up for a new plan, is October 15th through December 7th. That's the end. You have to make a change, if you're going to make a change, by December 7th. And those changes will take effect as of January 1st. So be aware of that. In Massachusetts, we have available Supplement 1 insurance plans, have open enrollment year-round, which is different from other states. So just know that. Medicare Advantage plans, which you may or may not know much about, are also called Medicare C plans. They're a supplement to A and B, your hospitalization and your physician providers, as well as drug coverage, all in one plan. And those are Medicare Advantage plans. And their open enrollment is right now as well. And this is the only time that you can go into one, unless you're newly retired and it has some months to get into the plan. It's your initial enrollment period. But for those of you who've been retired for a little while, those plans have open enrollment right now. And it's important to know that, because you cannot, it's not a year-round open enrollment for Medicare Advantage plans. Let's see. Also, this time, I'll be right with you, ma'am. This time of year, it's also open enrollment, and this is the only time it's open, except for some special examples, for your Medicare D or your drug plan enrollment or change. And this is a good time to take a look at the medications you take, about your health, what's changed from last year, where your medications fall within your insurance company's formulary, because sadly, if you take Lipitor, it might be on a different tier depending on which insurance company you go with. This is a really unpleasant aspect of the Medicare program. All insurance companies don't have to put all medications in the same tier. So depending on which plan you choose, you need to look at where your medication falls in that tier, because that will affect your co-pays, and so on and so forth. So this is a time to make those sorts of changes as well to your Part D plan. It's actually huge about that. So at this time of year, you want to take a moment to review your current insurance plans, compare plans. You get the Medicare and You 16 booklets. So you want to take this opportunity to look at your current plan and where your medications fall. And it's also an opportunity to decide whether you want to stay in your current plan or change. Again, the deadline is December 7th. And you can call right up until the deadline. Yeah, probably just don't want to wait until the last moment, which is why we try to do this on the early side. And you have actually two big options to choose from as far as a supplement to your current Medicare. As you probably already know, most of you here have been retired for a little bit. Medicare, straight Medicare, Parts A and B, only covers 80% of your coverage if you're hospitalized or if you go to a doctor. Each of them, straight Medicare, no supplement, each has a deductible if you don't have a supplement or a Medicare Advantage plan. Currently, we We don't have the deductibles for A and B yet. It hasn't been firm. But if we go with that amount from 2015, when you're hospitalized without any supplement and straight Medicare, when you go to the hospital, you're going to pay $1,260 to walk in the door. If you're out of the hospital, now you've been out for, like, say, 3 days, and then on day 5, you're hospitalized again. Something happens. You will get another, day 65, you'll get another $1,260 deductible. You have to be out of the hospital 60 days, and then you get another deductible. So that's huge. So it's not just $1,260 based on 2015 per year. It's every 60-day period that you're not in the hospital. So that's why folks seek a supplement, because Medicare, straight Medicare, just doesn't cover it all. So be aware of that. So you have two options. You can go with a Medicare Supplement 1, or you can go with a Medicare Advantage plan. They each have pros and cons. A Medicare Supplement 1 has a higher per month premium. For instance, this year so far, and again, we don't have the 2016 premiums set for Supplement 1s, but we have heard that, say for instance, Blue Cross Blue Shield MedX, that'll be about $186 and change. That's the cost for Supplement 1, plus your drug plan, your Medicare D plan, which is separate from that. And what that will enable you to do is to have health care with virtually no co-pays or deductibles. Supplement 1's pretty much cover it all. You pay higher up front in your monthly premium, but they cover all of your health insurance needs. You're not going to get additional costs, additional fees. You're not going to have co-pays, you're not going to have deductibles. Medicare Advantage plans, if you want, or Medicare C plans, include your drug coverage. They supplement A and B, but they have low monthly premiums. They can go anywhere from $0 to $200. But what they do is they are essentially saying to you, pay as you go. If you go with a lower monthly premium, you're going to pay co-pays and deductibles, $20, $40 for straight physicians or specialists. You're going to have a co-pay when you go to the hospital. Might be depending on the plan you choose. And again, this is where you need to look at your A, your comfort level, and B, what the plans have to offer. They might charge $200 a day as a copay if you're hospitalized. So Supplement 1s, you pay up front in a higher monthly premium. Medicare Advantage plans have a more of a pay-as-you-go approach. They're particularly popular with folks who are on the young end of the retiree spectrum in terms of age. You might have very little going on in terms of your health. You're in really good health. You take few medications. That might be a wise choice for you. It doesn't do anything for the fact that you might get hit by a bus tomorrow, and then that's a whole different story. But for those who are kind of on the young end of the spectrum and in excellent health, it's kind of a good way to go. It'll help supplement Medicare, but with a low-cost approach. And this nice lady wanted to ask a question, but if I could ask, if everybody would sort of just wait till I get through this bit, and then I'll just open it up for all kinds of questions and answers. And I'll have an opportunity for you to make an appointment, and we can go over your medications one-on-one, if that's okay. Okay? So that's essentially the difference. And if you're in a Medicare Advantage plan, and say you choose a Blue Cross Blue Shield Medicare Advantage plan, or Fallon or Tufts, you will go with their prescription drug plan as well. You cannot buy a separate standalone plan for your drug coverage. You have to go with theirs because it's a combination plan. All right, just so you know. And an insurance company cannot sell you a standalone plan if you're on a Medicare Advantage plan. So that's important to know. As an aside, this is just my own little pet peeve. I always suggest folks not have their insurance premiums taken out of their Social Security check, because we have an opportunity every year to change. And I always sort of feel like it's more difficult to have Social Security stop deducting things than it is to have them start. And if you decide to change, they will catch up with you and you will be reimbursed for whatever they deducted over, say a 2-month period. But, still you're out those 2 months while you're paying for a new plan, plus they're still deducting the old one. So I sort of feel that's not always the best approach. I know it's kind of handy in terms of, bill paying, but that's just sort of my opinion. And as far as Medicare D, that premium, that is deducted from your Social Security check, or you're billed quarterly for it if you didn't have enough quarters to qualify for Medicare, A or B. Another piece about the Medicare Supplement ones that have that higher monthly premium, there are no network restrictions, and drug coverage is not included. When you're with a Medicare Advantage plan, they're either HMOs or PPOs, HMOs being health maintenance organizations that have a network that you must stay within, or PPOs, preferred provider organizations. Again, they have preferred providers that you would see. If you go out of that group, if it's a PPO, it's possible, but you will pay more. It's possible to go elsewhere, but you will pay more. With an HMO, they do not pay for you to go to Mass General. They're not going to pay for you to go to Brigham and Women's. So just know that with regard to the Medicare Advantage plans. With the supplement ones, there are no restrictions. I think we pretty much covered that. When you look on your sheet, and it's in your packets, it's the 2016 Essex County Medicare Advantage plans or Medicare C plans. The lower part, after you see all those X's, are plans available to folks in nursing homes, SNFs, who are there. Those plans are sort of not for you to choose, really. It should be a yellow sheet you have. Karen, hold that up. There you go. It looks like that. You want to make sure that you're looking at the Essex County side, not the Middlesex side, because, and this is another caveat, Suzanne, or you, when you're talking about health insurance coverage, we all talk to family and friends. Be really careful about that, because plans that are available in Essex County with a certain dollar premium amount are not the same that are available in Nantucket, or that are available in the Berkshires, or that are available in Middlesex County. It's, again, another one of those strange things about insurance. In the state of Mass, it depends where you live, determines what's available to you and what you pay. So be very careful about that. I have a sister in New Hampshire. The options that will be available to her are quite different than the options available to me. In Massachusetts, we have A, B, C, and D. In New Hampshire, they have a full alphabet soup of options available that offer you a little of this, a little of that. They're quite different than what's available to us. So when you're talking to friends and family, be really careful, because the opportunities and options are different depending on where you live. That is a very strange piece. I think we've kind of summarized, the pros and cons of each plan. Then my favorite, Medicare D, the prescription drug coverage. Be aware, if you have nothing going on and you take no medications, you just take an occasional vitamin, a little vitamin D, something like that, a multivitamin, and you say to yourself, why am I going to pay for a Medicare D plan if I don't have any medications? If you don't sign up when you're eligible, whether that's because you're newly retired, just turning 65, or retired when you're 70, if you don't sign up when you're eligible, you will receive a penalty from Medicare. And that will be for the Medicare D plans, and this is also true of Medicare B, but it's a different percentage. If you don't sign up when you're eligible, you will receive a penalty of 1% per month for every month you did not sign up when you were eligible to do so, which will be attached to the baseline amount for drug coverage. For instance, this year in 2016, I think the benchmark amount is $34.10. So if you don't sign up for a whole year, it's going to be 12% of that $34. You will be penalized for the rest of your life. It's not just a one-shot deal. It will be for the rest of your life. So be aware that there's a penalty for not signing up. You know, when you're 65 and everything's great and life is good and you have an ailment in the world, you know, you're wanting to save money and not sign up if you don't have to. So in cases like that, I suggest just go with the least expensive plan that has a big fat deductible and you're sort of all set. Or you can be more chancy and say, well, say you didn't sign up for 10 months. What's the 10% penalty against $34? It's 34 cents. So sometimes folks will take that approach. It's up to you. Again, it's, you know, how risky are you feeling? So just be aware there is a penalty for not signing up. So that said, this is the time of year when you have an opportunity to change your drug plan. Unlike the supplements in Massachusetts, this is the only time that you're able to change drug plans, with a couple of exceptions, and I'll talk about that in a minute. You want to choose a drug plan to cover the medications that you take and the frequency, and make a choice based on your comfort level. For 2016, the most that insurance plans can charge you for a deductible, which again, if it's a high deductible, you're probably going to have a lower monthly premium, is $360. Oftentimes, that deductible does not go against tier 1 and 2 medications. So if you take generics or preferred generics that fall into that tier 1 and 2, that deductible won't apply to you. That usually only applies to tiers 3 through 5 drugs, which might be brand names, non-preferred brand names, and perhaps specialty cancer drugs and that type of thing, or just specialty drugs. So again, it's that thing, what are you comfortable with? Some folks would rather have 0 deductible, might pay a little bit more. That's something to consider. The other really important part is, David might have X medications and decides to go with AARP United Health Medicare D plan. And Nancy and David chat among themselves and they say, oh, that's what I have, and this is what my premium is, and this is what I have for drug payments, you know, in terms of co-pays for the medications I take. And Nancy might say, that's a swell plan, I like that, that would work for me. And so she signs up for that. But in actuality, Nancy's medications might be quite different from David's. And so if she signs up for that, based on that interaction, she might be in a pickle. She might pay more co-pays for the medication she takes. She might wind up in the donut hole, which we'll talk about in a minute, that wretched donut hole. And so that's not the best approach to take when it comes to choosing a Medicare D drug plan. You want to, if you're not comfortable going to the Medicare.gov website, you can jot down any medications you take for me, and I'll search them for you on the Medicare website if you fill out this yellow form that's in your packet. It doesn't take long, it's kind of quick. You can email me your lists. Anybody at home, you can email me your lists. My email address is on the website, the grovelandma.com website. It's also on the front page of our newsletter, so you can email me your drug list. You can drop it off here at Town Hall, and I'll do a search for you. And what happens is, when you give me the drug, the dosage, so many milligrams, blah, 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 and how many times a day you take it, I can do a specific search for your medications, and the Medicare.gov website generates a list of companies that cover all of your medication. That's important, because you might have one little weird one among the normal, sort of everyday ones, and it will put them in order of cost for you, overall cost for the year. So that's a worthwhile approach. And I'm happy to do that if you're not comfortable going to the website itself. The website's pretty straightforward, but I'm happy to do that for you. Again, it's your tax dollars at work. But it's specific and it's helpful. And that's important to know. And when I go into the Medicare.gov website, I do not put in names, I don't put in Medicare numbers, I don't put in Social Security numbers. I go in as a guest based on 01834, just based on our zip code. And it'll generate the website, once I key in a couple of medications, it'll generate a drug list ID number. It'll generate a password date, which is any date you want to make, or today's date, against our 01834. So it's general, it's based on your meds, and once it generates that drug list ID, I could go in each year for you, or you can go in once you get the hang of it. You can go in each year and tweak that list. You can remove medications that you no longer take, increase the dosages of some that you do, or add new medications. And it will generate each year a new list for you of useful insurance companies that cover all your meds at a cost that you're willing to go with. And again, it's that option of, do you want to go with a zero deductible, do you want to go with the 360, however you want to do it. But I'm happy to do that for you. The sooner you get those to me, the better, because what usually happens each year, as we get close to December 7th, all of a sudden I get this mad influx of medication lists, and then the whole system is slower by then. By then, there are a lot of sort of late folks, and the Medicare website itself just is like, takes forever. So the earlier the better, I think, in that regard. So basically, bottom line, be an educated consumer. If you do a little bit of homework and I do a little with you, we can save you some money. The donut hole, the ever fabulous but ever shrinking donut hole, is simply this. In 2016, the initial coverage limit has increased to $3,310. So, and by coverage limit it is the amount your insurance company pays plus the amount you pay in co-pays. When that reaches $3,310, you're now in the donut hole. The donut hole is also called the coverage gap. And that means the percentage you pay for your medications greatly increases. And then once your out-of-pocket threshold is reached, which is $4,850, then you go into catastrophic cost sharing. Now you're out of the donut hole, and then you're only paying 5% of the cost of your medications. There should be a little summary in there of how that goes. For those of you who go in the donut hole, which by the by started off lower and folks went into it sooner, but as the years progress, that threshold has increased so that by the year 2020, we will have no more donut hole. So that will be a huge relief for a lot of folks. Sometimes it doesn't take much, and not very many months go into the new year when folks go into it. So it's important. And there's there's one tremendous program to highlight, and that is called, within the state of Massachusetts, the Prescription Advantage Program. That is a supplement to your Medicare D supplement. So once you have a Medicare D plan, depending on your income, and there should be a cheat sheet about that in your packet. For many people, there will be no annual fee for it. depending on your income, if it's over a certain amount, you'll have a $200 flat fee. It requires an application, which is quite simple. They have just a few income verification documents that they want you to send along. But it does two tremendous things. It cuts your costs in the donut hole, and it allows you to make a prescription D drug plan change off of open enrollment. So that if the plan you're currently on, say in March, say you go in the donut hole in March, there are folks that happens to, and you realize your current drug plan is not working for you, it gives you an opportunity as a Prescription Advantage member to change that drug plan off open enrollment. So it helps with that, and for the majority of folks who don't have terribly high income, it allows you a reduction in what you pay in the donut hole for your drug coverage. We talked about that 3310 puts you in the donut hole. When you hit the donut hole, you will pay 45% of brand name drug costs and 58% of generic drug costs. So that's a lot, just FYI. What else? We talked about that. And also in your packet is a little cheat sheet called Concerned About Medicare Costs? There may be help. And these give you some essential summaries of eligibility for Mass Health, eligibility for the senior buy-in, which can help with your Part A and B premiums, as well as deductibles and co-pays. Extra help for your prescription drug premiums. It'll reduce that premium up to this coming year, up to like $34. Prescription Advantage, it gives it a little summary of that. And you can see at the bottom, the Prescription Advantage income guidelines. So, you know, so without ever having to tell me anything, with regard to your private business, it allows you to take a quick look. And I sometimes put this in the newsletter just to remind folks of some opportunities to save money that are available. I also sometimes keep them on the front end table when you come into the lobby, just a little FYI. Did you not get that? It's white. If you don't have it in your packet, let me, no, that's the Prescription Advantage.
Yeah, I got it.
Did you see it?
Yep.
It's white. Ordinarily in your packets, I would have what we call the blue sheet, which is a summary of the Supplement 1 plans in Essex County and Mass that are available to us, but they haven't been confirmed. So even though I have sort of a cheat sheet, I can't share it because they haven't been confirmed by all insurance companies. That's the blue sheet. So in a couple of weeks, if you want to call me and ask if or email and ask if the blue sheets are available, I'm happy to respond. It's just a handy bit of information. I mean, you have all of that in the back of your Medicare and You 2016 book, the plans that are available in our state, in our area. But they haven't been confirmed, so I can't share it. The other thing that we haven't had confirmed yet are the A and B deductibles. Last year, and that's called the green sheet. And if you want to call at the same time and ask if I've got those yet, wanting to make lots of extra work for myself, call me and or email, and I'll let you know if I've got the new information. Last year, the green sheet or the summary of benefits available through Medicare A, which is basically your hospitalization coverage, and Medicare B, which is essentially your physician, care providers piece. $1,260 was the deductible for hospitalization. $147 was the deductible for physician Part B coverage. That is without any other supplement or Medicare Advantage plan, you would pay the first $147 of any, physician care providers that you see, and $1,260 should you be hospitalized. So just be aware of that. Another little side note, Medicare does not cover you out of country. So you can go to Canada and you will not receive, Medicare will not cover your care there. In an emergency, they will, but by and large, if you sprain, if you're like in a terrible car crash, if you sprain your ankle, they're not going to reimburse you for that care out of country. Supplement ones do cover foreign travel, so that's anywhere but here. So just be aware that Medicare Advantage plans only cover when you're within their networks and within their provider group. Supplement ones do cover foreign travel, so that's kind of important to remember. There's a sheet at the very back called Helpful Resources. Hang on to that. That gives you info on Prescription Advantage. If you're having problems with billing and that sort of thing, and I can't help you, there are other places to go for that sort of help. Medicare Advocacy Project and the Senior Medicare Patrol. They're both very helpful in trying to solve problems. So with that said, happy shopping, and I'm happy to answer any questions anybody might have. Ma'am?
I got one about the income. If you make over $85,000 a year, but what if it's just 1 year? Because
They're going to look at 2014.
Oh, they're only at 2000.
So because we haven't received, for open enrollment period, we haven't received our information for 2015 income. So it would be based on your 2014 income for programs starting January 1st. Claire.
In 2014, I had a surge in my income, that 1 year only because of extra money that came in. But I'm going to be based on that 1 year episode?
For this year, for 2016. But in 2017, no, just for the 1 year. So, sort of back up 2 years. For instance, for open enrollment in 2016, they're going to look at income, your final income, your adjusted gross income for 2014. Yeah.
Would you talk about Obamacare? I had no idea.
The Affordable Care Act, aka Obamacare, really basically has no impact on folks on Medicare. With the exception that they do now, and this is a plus, it does now cover pre-existing conditions. So otherwise, it doesn't affect Medicare recipients. Ma'am, you've been very patient.
I'm not gonna be 65 until April.
Okay.
So do I have to sign up for open enrollment before December 7th?
No.
Or do I wait till next year?
Because you're a new retiree, you have a 7-month window to sign up without any penalty. We all are aware, if you don't sign up for Medicare B when you're initially eligible, there's a penalty involved. Just everybody aware of that? Which is 10% for every year that you didn't sign up when you could have, which is charged against your Part B premium. So if you don't sign up for Medicare, and I'll get directly to your question after a little detour. If you don't sign up for Part B when you're eligible, because you're saying to yourself, hey, why should I sign up? I'm in good health, I don't need to sign up for this, I'm good. I'll just pay it out of pocket, whatever might happen. You'll receive a 10% penalty against that $104.90 Part B premium. So that's $10 and some odd per month added. But that 10% stays the same, even though your Part B premium might go up for the rest of your life. Now, if you're about to retire, you have a 7-month window to sign up for Part B and Medicare D.
From what date?
Your
The date
birthday
for
month
65?
is, say, April. So you have 3 months before your birthday month and 3 months after your birthday month to sign up. So you really have a 7-month window.
So the calendar starts on January 1st.
Nope, for you, if you're turning 65 in April, March, February, January, you can sign up to have it begin April 1st.
So I need to sign up by January.
Or, you know, it's up to you, however you wanna do it. There'll be no penalty, even if you wanted to wait till 2 months after your 65th birthday month. There'd still be no penalty. Of course, you wouldn't have insurance, but there wouldn't be a penalty for not having. So you basically have a 7-month window to sign up around your 65th birthday. So, you know, if you're sort of like I am, you'd be like, oh, I'm getting on that, and you could call Social Security, sign up for Part B in January, and that it will become effective the first day of April.
And what's the difference between Part A and B?
Part A is all about hospitalization.
Okay,
Part B is physicians and care providers,
thanks.
and rehab, skilled nursing facilities, all sorts of things. Whatever doesn't happen in the hospital. Now,
My husband gets his prescriptions through the VA,
creditable coverage.
so if he decides to stop the VA and he wants to get into the program, will he be penalized?
No, but he'd want to do it during open enrollment.
Right.
But he would veterans coverage, which is, you know, a lovely thing, a lovely perk, and an apt compensation for military service. They have, by and large, some great plans available. So if you receive your health care through the VA, you don't have to worry about a supplement. I think they do require you to sign up for Part B, but you don't need a supplement necessarily. You know, you can do, but you don't have to. As far as Part D coverage goes, the drug coverage, veterans' prescription drug coverage is considered creditable coverage,
Okay, thank you.
and there's no penalty. And so he doesn't have to get it until he wants to. You know, until he decides, you know, to do something. The only rub is you have to receive your meds through the VA, which means, excuse me, you know, say you get strep throat and they have to put you on, an antibiotic, you end up going to CVS right away because it's an immediate, you know, it's an immediate need. But it's some great coverage. And so keep in mind also, if you're still working and you are on a group health plan through your employer, you don't have to sign up for A and B. You can sign up for A because there's no fee involved, there's no premium involved. But you don't have to sign up for anything because you have a group health coverage. So you can do that as long as you want, as long as you know your company's providing you health insurance coverage. You want to hang on to each year a statement from your human resource office that lets, you know, Social Security know later down the pipe that you have had creditable coverage while you're working. So,
Okay, not that I read it, they recommended when I was working to take Part A, because if my coverage ends and what I had, that kicks in as a secondary.
it depends on your company too, and it depends on how many employees they have. Whether some companies, if they're small, require you that's why you always want to check with your personnel officer, HR, to find out, does your company require you to sign up for A and B, excuse me, or D, because that becomes your primary care coverage and the company becomes secondary. Sometimes that's not the case, but sometimes it is. So if you're still working, you do want to check with your employer to find out, and you know, this can have, you know, negative implications if you don't sign up for Medicare and the company wants you to do that because they want to be the secondary payer. They don't want to be the primary for some companies.
That was-
Shocking.
I was the primary, they were the secondary.
Your Medicare is the primary.
No, the company is the primary and Medicare is the secondary.
Yep, sometimes that's how it goes. Depends on how many folks are working there, that has an impact on things too. Ma'am?
Yes, I'm looking at the PDP chart,
And it says monthly premiums after full LIS. What is-
LIS stands for low income subsidy.
Oh, okay.
And that is the premium you would pay after the benchmark is covered, which in 2016 is gonna be $34. There should be a chart in that ways to save on Medicare. Excuse me, I'm getting squeaky. This gives you an indication of the income limits to qualify for the low income subsidy, or, as they fondly refer to it, extra help. And lots of folks are eligible for that, but just are not aware, you know?
My other question is, I went into Medicare.gov and I listed all my medicines. And do I go to the date, when I put in the date that I listed all their medicines, or today's date?
You can put whatever date you want. Some people put their birth date.
No.
You can change that password date.
Oh, I can?
You don't have to use the today's date.
If I use today's date, it'll make me put my list all in again, right? I have to go to the,
You want whatever, did I print out a list for you?
yes.
Okay, so when you go into Medicare.gov, you want to use the password date on that sheet I gave you.
Okay.
Now, going forward, I've done this for some folks. Going forward, they give me the drug list ID number from prior year and the password date, which was generated prior years, and then sometimes I'll change that to this year's date, just so they know that their medications have been updated. And as long as you save that top sheet that I print out with your medications, it'll have that drug list ID number and the password date on it. Any other questions?
Do you have to reapply for prescription date every year?
Well, what they do is they'll send you a review, oftentimes, and you don't want to ignore that. But it's a great program. So, if there are no more questions, I thank you for coming. I hope I answered some of your questions, and now probably have generated a whole bunch more. Take care.
Thank you. Thank you.